Looks like we're diving into testosterone today. You've given us a lot to work with. Articles, YouTube videos, even some personal notes.
Definitely seems like you're doing your homework. Lots of interest in low T, TRT, even no nut November in here.
Yeah, there's a lot of info and misinformation out there, so we're going to separate fact from fiction.
Exactly. Like one of your sources, that interview with Dr. Rena Malek on Dr. Mike's channel, she really hits on that.
Okay, so you also have notes about boosting testosterone. What were you hoping to learn there?
Well, it seems like you're interested in everything from lifestyle changes to supplements.
Hmm.
And, Dr. Malik makes a good point. There are things contributing to lower testosterone these days that weren't as common a few decades ago,
Like what?
like rising rates of diabetes, high cholesterol, high blood pressure.
Ah, so it's more than just the plastic and chemicals some people blame.
Right, though that might play a small role. But Dr. Malik really focuses on what you can control: sleep, exercise, and stress.
Makes sense. Now, you specifically mentioned wanting to try insert supplement name from listeners' notes. What does the research say about that one?
Honestly, the data on a lot of these testosterone-boosting supplements is pretty minimal.
Huh. So is it all just hype?
Well, it's tough to say for sure. Like, Phaedogia agrestis is another popular one, but there are 0 human studies on it. 0.
Wow, okay, so maybe not the best strategy to rely on supplements then. What about those lifestyle changes? Anything stand out from Dr. Malik's advice on sleep, exercise, stress?
Well, she's big on those foundational things. For sleep, she suggests aiming for 7 to 9 hours a night.
Makes sense.
For exercise, high-intensity interval training, resistance training, especially exercises that use those big muscle groups.
Got it. And for stress?
Finding healthy ways to manage it, meditation, spending time in nature, whatever works for you.
Okay, that all sounds good, but in your notes, you also have no nut November. Any truth to that boosting testosterone?
Look, that's a myth. Dr. Malik debunks that pretty clearly.
So all that willpower for nothing. You even had notes about pelvic floor exercises related to that. What's the connection there?
See, pelvic floor health is important for men too, which a lot of people don't realize.
Really? I didn't know that was a thing.
Oh yeah. Chronic tension down there from stress, sitting all day.
Uh-huh.
It can cause all sorts of issues. ED, back pain, even pain with ejaculation.
Wow, okay. You even mentioned stopping your urine mid-flow as a technique. Is that something Dr. Malik recommends?
She actually cautions against doing that regularly.
Oh, really? Why is that?
It can help you identify the muscles, but doing it too much can actually cause more tension down there.
Interesting. So what does she recommend for keeping things healthy down there?
Regular exercise, stretching, avoiding sitting for too long, proper urination techniques.
Got it. No more holding it in more ways than one, it seems. You were also curious about TRT, seeing a lot of ads for it lately.
It seems that way. And Dr. Malik acknowledges it's gotten really popular, but it's not a magic bullet for everyone with low T symptoms.
Right, right. So you mentioned feeling fatigued, having low libido. Could that be low T?
Possibly. But Dr. Malik really emphasizes getting a proper diagnosis, blood tests, ruling out other causes.
Makes sense. You also had a note about a study where a urologist went undercover to these testosterone clinics.
Oh, yeah. And that kind of gets at what Dr. Malik was warning about. Some places prescribe TRT without proper protocols monitoring. That can be risky.
Yeah, that sounds concerning.
And then there are potential side effects to consider: acne, breast enlargement, maybe even speeding up hair loss if you're prone to it.
Oh, right, right. Anything else to watch out for?
One thing she always emphasizes, especially for younger men, is infertility.
Yeah, definitely something to consider.
For sure.
So TRT is obviously a big decision. You need all the facts before jumping in. What about ED? That was another concern in your notes.
It seems like you're connecting it to the testosterone stuff. But actually, Dr. Malik says low T isn't the main cause of ED in most men.
Really? If it's not hormones, what is it then?
Vascular disease, actually.
So like a circulatory problem. That's kind of surprising.
It seems counterintuitive, but think about it. The blood vessels in the penis are tiny compared to the heart. So if there's blockage, it'll show up there first.
Huh, okay.
She calls ED the canary in the coal mine for heart problems.
Wow, that's a powerful way to put it. So ED could be a sign of something more serious.
Exactly. There are studies that show a good chunk of men with ED will have a heart attack within a few years.
Oh, wow. Okay, you also mentioned psychogenic ED. What's that exactly?
That's where performance anxiety and stress basically create a vicious cycle. You get anxious, you have ED, you get more anxious. Tough to break.
Sounds like it. What about treatments? You were curious about those little blue pills.
You mean sildenafil, tadalafil. They're generally safe when used properly, but not for everyone.
Right. Are there risks with those?
The main one people worry about is priapism, which is basically a prolonged erection that can cause damage, but it's extremely rare, especially with those meds. The biggest no-no is for guys taking nitrates for heart conditions.
Gotcha. What about other options? You mentioned injections.
There are a few. Intraurethral suppositories, vacuum devices, those injections. Each has its own pros and cons, depends on your situation and preference.
Right. So you were particularly curious about the injections, huh?
You seem a little apprehensive about them. It's understandable. But Dr. Malik explains the needle's tiny, usually not much discomfort.
Well, that's good to hear at least. But do they work?
Very high success rate, but there's a slightly higher chance of priapism than the pills. So you got to use them, right, with a doctor's guidance.
Makes sense. So much to consider with all this. You also had notes about penis size. What did you want to know there?
It's like you were interested in the psychology of it and also maybe ways to increase size.
Yeah. It's like that question, am I normal? A lot of guys worry about that. What does Dr. Malik say about all that?
She gets it, you know?
Yeah.
It's a common concern. She stresses the importance of a multidisciplinary approach, talking to doctors and mental health pros.
Okay, so it's more than just the physical aspect then.
Right. And about increasing size. She busts some myths, like pumps and extenders only give a temporary change.
Okay.
And surgery. She's very cautious about that.
What kind of risks are we talking about?
Scarring, loss of sensation, even being unhappy with the results. And often the changes aren't that dramatic anyway.
So not a guaranteed fix and some serious potential downsides. What about non-surgical stuff? You had a note about traction devices.
Those have shown some promise for length, but you got to wear them a lot every day. And we still don't know about long-term effects.
So no quick fix there either. What about just losing weight, exercising more? Can that help?
Well, losing weight, especially belly fat, can make the penis appear larger.
Really? How's that work?
It's not actually changing the penis itself, but it reduces that fat pad above the base, so it looks bigger.
Interesting. Perception versus reality, I guess. What about exercise?
She doesn't specifically talk about exercise for size, but she does emphasize overall health and fitness for sexual well-being.
Right. Makes sense. It seems like she's all about focusing on what you can control, not chasing quick fixes or impossible standards.
Exactly. Be informed, look at the evidence, not just hype, and talk to qualified professionals.
Solid advice. We've covered a lot already. Testosterone, TRT, ED, pelvic floor, penis size.
We have. But there's more to unpack. You had questions about prostate health and communication, too.
Right. We'll dive into those in the next part.
You know, before we jump into prostate health, there's something else you mentioned that fits in with what we were just talking about with ED.
Oh.
That note about wanting to explore different sexual preferences. It's like you're really focused on optimizing your whole sexual health experience.
Yeah, I mean, that makes sense, right? Wanting to have a good sex life.
Absolutely.
Yeah.
But sometimes when we're so focused on optimizing, we forget about some of the really important stuff.
Like what?
Well, we've talked about testosterone levels, ED meds, even how to last longer.
Right.
It's easy to get caught up in the mechanics of it all and miss the emotional, relational side of things.
I see what you mean. Too much focus on performance, not enough on connection and enjoyment.
Exactly. Sex is more than just the physical act. It's about intimacy, connection, pleasure, and good communication.
And we've talked a lot about communication already. Any tips for talking to a partner about sex, especially when it comes to trying new things?
Honesty and respect are huge. Come to the conversation with curiosity. Be willing to listen. Your partner's feelings are just as important as yours.
So, create a safe space where both people feel comfortable.
Yes, no judgment, no shame. And remember, communication isn't just talking, it's listening too. Really understanding your partner's perspective.
Okay, so let's say you've had that conversation, you know each other's boundaries and all that. What else makes for a better sexual experience?
Focus on the journey, not just the destination. Don't be so fixated on the orgasm that you miss out on everything else. Explore different kinds of touch, different positions. Pay attention to what feels good for both of you.
Being in the moment, mindful.
Exactly. Mindfulness is huge for pleasure. When you're really present in your body, you experience things more intensely. And hey, don't be afraid to laugh. Sex can be fun, playful. Lighten up, let go of expectations. Just enjoy that connection.
Love that advice. Okay, let's shift gears now. Talk about prostate health. That was another thing you wanted to know more about, especially prevention, right?
Yeah, it's a common concern for sure. Prostate cancer is one of the most common cancers in men. But the good news is there are things you can do to lower your risk.
So where do you start? I know there's been debate about PSA testing. What's the latest on that?
Nowadays, they recommend a shared decision-making approach. So you and your doctor have an honest conversation about the pros and cons of screening, taking into account your age, family history, race, all that.
Makes sense. It's not a one-size-fits-all thing.
Right. And beyond the testing, there's lifestyle stuff that can help.
Like all those healthy habits we keep coming back to.
Exactly. Healthy weight, regular exercise, good diet full of fruits and veggies, those are all important. There's even some evidence that a diet high in lycopene might be good for the prostate.
You actually had a note about lycopene. Did you do some research on that?
Seems like you're intrigued by it, but also wondering about supplements, right?
Yeah, I saw some stuff about that. Are lycopene supplements as good as getting it from food?
The research on the supplements isn't as strong, unfortunately.
Mm-hmm.
It seems like your body handles lycopene better when it's coming from actual food.
So, another supplement myth busted? There really aren't any quick fixes, are there? It's all about those consistent, healthy choices.
You got it. When it comes to prostate health, or really any aspect of health, focus on those foundational things. Good food, exercise, managing stress, and of course, talk to your doctor if you're worried about anything.
Good advice. And speaking of talking to your doctor, you had some notes about communication in general. It seems like you want to be better at advocating for yourself in medical settings.
It's a really valuable skill, for sure. Can make a big difference in your health outcomes. You mentioned feeling intimidated, not sure how to ask the right questions.
Yeah, sometimes. It's like, am I bothering them or are my questions dumb?
I get it. But remember, doctors want you to be involved in your own healthcare. A good tip is to write down your questions beforehand.
Oh, yeah, that's a good idea. It's hard to remember everything on the spot.
Right. So having a list helps you stay focused. And be honest, even if it's embarrassing, doctors can't help if they don't know what's going on.
True. So be proactive, speak up. What about communication in your personal life? You mentioned wanting to get better at that with your partner.
Communication is the foundation of any good relationship, right? Being open, honest, respectful, and being a good listener, which we talked about before, really understanding what your partner's saying.
You've brought up listen several times now. It's clearly important.
Huge. You create that space where both people feel heard. One way to do that is active listening, paying attention to what they're saying and how they're saying it.
So it's not just the words, it's the body language, tone of voice.
Exactly. Those nonverbal cues can tell you a lot.
That makes sense. Any other tips for better communication in relationships?
Sometimes we overlook the simple stuff, just spending quality time together.
Yeah, life gets busy. It's easy to let that slide.
Right. So whether it's date night, a weekend away, even just 30 minutes a day to connect without distractions, make time for each other.
It's about being intentional about that connection.
Exactly. You've gotten some great insights on communication, both with doctors and in your relationships. Seems like a common theme is being open, honest, and respectful.
Definitely. It goes both ways, right? Express yourself clearly, but also really hear what the other person is saying.
Exactly. Communication's a skill. The more you do it, the better you get.
Well, we've covered so much today: testosterone, ED, prostate health, communication.
A lot of ground covered.
Yeah.
But there's still more. You also mentioned wanting to explore different sexual preferences.
Oh, right. That's a big one. And it seems like it ties into a lot of what we've already discussed.
Yeah, and it's interesting because you mentioned wanting to explore those preferences. And it seems like maybe that's bumping up against some of those traditional ideas about masculinity we were just talking about.
Yeah, I think that makes sense. A lot of men feel conflicted about their desires, especially if they don't fit what they think is normal or manly.
Right, but honestly, there's a huge range of normal and healthy sexual preferences. And exploring those with curiosity and openness can be a really empowering thing.
It's about giving yourself permission to just be who you are,
Yeah.
without judgment or shame.
Exactly. And that's not always easy, especially with all the mixed messages out there about sex and masculinity.
We talked about communication being so important in relationships. How can men use those skills to talk about these things that can be kind of sensitive?
It starts with you got to be honest with yourself about what you want and need. And
Yeah.
once you know that, then you can start talking to your partner about it in a way that's respectful and open.
And that probably takes some vulnerability, right?
Oh, absolutely. Vulnerability is key in any close relationship. It's about letting your guard down and letting your partner see the real you.
It can be scary to do that, though, especially when it comes to something as personal as sex.
I hear you, but it can also be incredibly rewarding when you can share your true self with your partner. It creates a deeper level of intimacy and connection.
So it's about trusting that your partner will be accepting and understanding, even if it's something new or different.
Exactly. And if they aren't well, then maybe it's time to rethink the relationship. A healthy relationship is one where both people feel safe and supported to be themselves.
That's such an important point. It's not just about sex, it's about accepting every part of yourself.
You got it. And that's really what mindful masculinity is all about, letting go of those old limiting beliefs and embracing a fuller, more authentic version of yourself.
This has been such a great deep dive. We've covered so much from the biology of testosterone to the importance of communication and this idea of mindful masculinity.
It's been a pleasure talking about all this with you, and hopefully it's been helpful for our listener too.
I'm sure it has. And to our listener, thank you for joining us on this journey. Remember, your health is a lifelong process, so keep learning, keep exploring, and keep taking care of yourself.